Welcome to Nami Live, your community mental health. I'm Susan Racher, volunteer board chair of Nami, Miami-Dade County. We are the local nonprofit affiliate of the largest mental health organization in the country, and we serve the Miami-Dade and the Keys with free educational and support programs. Our program today focuses on a topic that is truly life and death. One that is met with silence often, and one that is taboo, and that is suicide. Today, you will learn how to understand warning signs of suicide, what to do, and what resources to pursue if you, a loved one, or a friend need help. You'll also get a preview of Miami's first suicide prevention conference, Honest Talk About Suicide and Messages of Hope, on Saturday morning, March 4th at the University of Miami Alumni Center. Registration is at namimiami.org, and please register quickly. We are almost at capacity for this amazing event that you will hear more about today. I am delighted to welcome two experts in mental health and suicide prevention to educate us today and to provide important takeaways and information for you. Dr. John Newcomer is president and CEO of Thriving Minds South Florida, a large nonprofit organization responsible for overseeing the provision of mental health and substance use services for the uninsured and underinsured in Miami-Dade and Monroe counties. Reverend LeSueur is a pastor at Coral Gables Congregational Church and is our NAMI Suicide Prevention Coordinator. Welcome, Dr. Newcomer. Welcome, Reverend Lisa.
Thank
Let
you.
us start out with a little bit about your backgrounds, and Dr. Newcomer, tell us and the audience about Thriving Mind.
Yeah, so, Susan, thank you for inviting me, and glad to be here. I'm a psychiatrist by training, and have been in practice, inpatient, outpatient, and research for over 30 years. Mm-hmm. And for the last 5 years, the president and CEO for, as you said, Thriving Minds South Florida. It's important for the audience to know that we're one of 7 of these so-called managing entities that fund a safety net of services for people with mental illness, mental health issues, and substance use problems. But also we fund prevention and of course fund NAMI for the wonderful work that you do.
Which we are so grateful. You actually helped start the reboot of NAMI in 2016 as we grew the organization.
So we end up touching about 130,000 people each year with either prevention services or direct treatment services, and we do this with incredibly low overhead, less than 5%, and an operating budget of around $135 million.
Thank you. Reverend Lisa, you have led the launch of NAMI's first suicide prevention initiative, a robust educational and messaging program for more than a year. What brought you to this work? And tell us a little bit about your ministry.
So most of my ministry and my desire to work in suicide prevention comes from my own personal experience. One, as a person who has dealt with suicidal ideation since the time I was a teenager and never heard anyone else speak about it until I was an adult a couple of years ago. And when it was a respected colleague who mentioned it at one of our meetings, my ears perked up and I got all excited because I realized, no, I'm not alone. And I also have had experience dealing with a loved one who had suicidal ideation that resulted in a suicide attempt and a Baker Act. And just
so hard.
realizing that I didn't know what the signs were, the doctors who were treating her, it wasn't on their radar. They'd never mentioned it because she never mentioned it to them. And so the importance of understanding the warning signs, knowing what they are, and knowing how to act on that as a loved one or somebody in a work setting or school setting that's aware of somebody going through something is the reason that compels me to do the work with QPR and suicide awareness.
And we are so grateful that you do. Most people don't realize that suicide may be preventable, and an intervention can be from any one of us.
Exactly.
And your program is amazing, and we will give the audience information at the end on how to access your fantastic lectures. Just a little about myself. I'm a volunteer board president. Nami is the largest mental health support, education, advocacy organization in the country. Everything we do is free. My life, my community, my friends, my family have been touched by suicide as well. Many times, far too many times. My son's best friend from high school ended his life in engineering graduate school, and it was a profound trauma for his family, his friends, my son, our family, and the community. Because suicide affects everyone. And what people don't realize is that for every suicide that happens, over 130 people are affected with deep trauma. And that is something that is important for us to consider as we educate the community. This is a really important topic, and this is the reason why Nami and Thriving Mind have partnered with the support of the Department of Children and Families, Florida Department of Children and Families, to launch this suicide campaign, trainings, messaging, and the conference. Let's talk a little bit about the scope of the problem and level set the context before we get into some of the ways in which we can intervene in a suicide. Post-pandemic, we've seen an alarming decline in mental health, right? We've heard about it from virtually every mental health organization, every medical organization. And last week, the Center for Disease Control issued their Youth Behavioral Risk Survey based on a survey of 17,000 high school students in 50 states in the fall of 2021. And the results were really concerning. I'd like to share two charts with you. Chart 1, in 2021, 42%, that's almost half of all high school students, indicated that they were feeling so sad and hopeless that it interfered for more than 2 weeks, which is generally the benchmark for a serious episode of depression. For more than 2 weeks, that interfered with their functioning. It was 59% female, indicated that. That's more than half, and 69% for the LGBTQ community. And those numbers have risen. That's alarming, and that's up 50% from a decade ago. Chart 2, the same survey indicated that 1 out of 10 high school students, 10%, have attempted suicide. Think about that. Class of 30 students, 3 students have attempted suicide. 6 students in that class developed a plan but didn't execute on it. So this is a very, very important topic. And I'd like to start out by trying to understand why you think this is happening. What is going on with not only our youth? The youth survey indicated the unwellness of youth, but those numbers are across the board in every age range, and particularly young adults, 20 to 35. Why do you think this is happening, Dr. Newcomer?
Well, I think obviously this is multifactorial. Lots of things going on. And I think the first point that's worth making is that we weren't talking about this 10 years ago.
Right.
As a psychiatrist,
That's
we were
very-
talking about it, but
right.
There's a silver lining here that there's an increasing public awareness of this. We're having conversations like the one we're having today. And so a certain amount of people's sort of shock and awareness of this now is finally seeing what was really going on out there.
Right.
But then, of course, there are real increases that have happened on top of that. And lots of people are, scratching their heads and speculating about all the factors that may be contributing to that. Certainly, it's not just the pandemic, although the pandemic happened at the time that it did and coincided with numbers going up. But I think this is set against a background of changes in sort of economic potential, particularly for young people. They look ahead to what they're going to face and what sorts of hurdles, and there's a certain realistic sense of fear, and this is daunting,
Right.
And so I think that's part of it. The other issue is the fact that we can now communicate so easily across all these different platforms and social media. Again, this is a great tool for us to bring awareness. On the other hand, this is also how the kid, the 17-year-old kid in the small town, in Wyoming, who 25 years ago wouldn't have heard about suicides going on in other parts of the country,
Right.
now is hearing about them on a regular, sometimes daily basis.
Right.
So it's bringing it into people's consciousness, and I think in some ways that does contribute.
It almost normalizes it in a harmful way. Also, as children, past generations didn't have mass shooter drills.
Yeah.
And that has to have trauma as well. And Reverend Lisa, you have taught hundreds of people in the amazing QPR program that you lead for Nami, Question, Persuade, and Refer. What do you hear from them as you bring this information to them about that might give us some insight into the rise of these numbers?
That particular, they don't discuss that as much as they discuss the overwhelming concern, particularly for our youth. They're not as concerned as with the cause as they are with the result. And so we've had quite a few teachers that come on talking about how alarmed they are with what the changes that they're seeing in the mental health of the students that they have. Parents, we've had grandparents and family members who come who are dealing with a suicide that has recently happened in their family of a young person. And that's what I'm hearing over and over again, is that a lot of it is our young people that are tragically being lost to this. And I have my own 14-year-old daughter, and the pressures that she goes under with school, and that constant news cycle that even if kids want to get away from it, their friends know everything that's going on. So it's that constant concern about world affairs and what's happening and economics, and then the social media that just kind of exacerbates everything that the traumas, the stresses that were already there just kind of get mushroomed and blown up.
And it's difficult to turn that back, but as parents, as employers, as teachers, we need to understand when and how to intervene and what to do.
Yep.
We can't turn back the news cycle.
Right.
We can't undo social media. So then the question is, what do we do? And Dr. Newcomer, Thriving Mind has been an incredible leader in the community, in mental health, in bringing innovation to the community, in its programs, and in crisis response. Can you tell us a little bit about what advice would you give families, friends? And I'm getting a lot of calls lately, by the way, from the workplace.
Yeah.
Employers out there need to be cognizant of this. What to do when you believe or are worried that an individual is at risk of self-harm or worse.
Yeah. Well, so you mentioned at the beginning, Susan, quite accurately that Thriving Mind and the other managing entities started out legislatively required here in Florida to be focusing services on the uninsured and the underinsured. But over time, actually, there has been a mission expansion with additional statutes and additional assignments, so that now for mobile response teams, 988, programs like Nami's, we're not just for the uninsured and the underinsured, it's for the entire community. And it has to be that way. Then when somebody does need to get connected to services, if they don't have insurance, we're there to be that safety net. But I think, you're going to hear from the Reverend about some of these great, like person-to-person interventions where if you see something, explore.
Say something,
right?
right.
But obviously, you and I get questions all the time. Well, what if it rises above that threshold? Now you ask the questions and it looks very serious.
Right.
So there are numbers now. There's a national 3-digit 988 suicide and mental health crisis hotline. It's a national number. It rolled out relatively recently, and there are still some squeaky joints in the thing. So we're trying to work those out. But very important resource, so that now instead of just calling 911, where in many communities, there aren't CIT trained officers, there aren't clinicians that roll out, you have law enforcement rolling out, and it's just not their area of expertise. We have in our community historically also had 211, which is a great support number, but the message moving forward is use 988.
Right.
Okay. The other piece that we've had in our community are, you and I have both used the phrase mobile response teams. And this is in lieu of officers having to roll out. When someone has to go and see the family or see the individual, who should it be? Right. We think it should be people clinically trained.
Right.
That's optimal. When there isn't an immediate safety issue, no one's armed, law enforcement doesn't need to be there, let's get the clinicians to go there. With generous funding from the legislature, this past legislative cycle, additional dollars came to Miami-Dade County, to our managing entity, Thriving Mind, and we just finished contracting for 4 mobile response teams in Miami-Dade County. That'll be north, south, east, west. So when you call 988 or there's going to be on our website, you can already see the mobile response team number. They'll send somebody. They'll figure out what's exactly going on.
Right.
And sometimes the crisis might be handled over the telephone or an appointment made for 9 o'clock the next morning.
Right.
But sometimes somebody's got to go see them now. And the intervention could be right there, in your living room, or it could be that they need to go someplace and be safe.
And this is, in my opinion, this is the greatest and most significant development in improving mental health access and response in our community. I am so excited that 4 mobile units, people who are trained to come out and talk to not only the individual, but the family.
Yeah.
Because the family could give a lot of insight and could also help, support that individual in their crisis.
Yeah, and I'll make one more point, and that is laced throughout our whole system of care. We have 40 some odd healthcare provider organizations that we contract with. The whole underlying construct is no wrong door.
Right.
Right. So whether it's 988 or calling for a mobile response team intervention or walking in the door of one of the providers or calling our offices or calling Nami, wherever you go, the concept is everybody knows the drill, and we'll make sure that person, that individual, and that family gets connected to services.
That is amazing. So thrivingmind.org.
Thrivingmind.org
has
a great website.
Consumer line, people can call. You answer the phone. It's wonderful.
Yep.
You can also call NamiMiami.org. We answer the phone in English, Spanish, and French and Portuguese. 988 is our national number, but responded to locally by Jewish Community Services.
Yeah.
So we have a whole panoply of wonderful resources.
And on the Thriving Mind website, thrivingmind.org, you'll see a button in the upper right. It says Crisis. You click on that, and many of the resource numbers and contact information that Susan, you just laid out are all listed there in one place.
No wrong door.
No wrong door.
And there's support and help for anyone who needs it. And that's something the community doesn't realize.
Yeah.
And that's an important mission of this program and of the work that we're doing at Nami. Let's migrate into the education piece now. So we talked about a crisis, pre-crisis. I mean, how do you talk to someone? How do you manage that? Talk a little bit about QPR and how you train lay people like me and other folks to manage that conversation and to help friends and loved ones who are in crisis.
You bring up an important point that, no, you do not need to be a mental health professional in order to change the dynamic of a situation that could end up very tragically. And what we teach in QPR is that ability to talk to people. So first we teach how to recognize the signs, but then what do you do with that?
Right.
And, people have to get over their hesitation to talk about it. We need to normalize this. We need to normalize mental health and the challenges that exist by opening up the conversation. And so I always frame it not just by asking the question, are you thinking of suicide, but opening it to a bigger conversation. What's going on? If you're seeing some warning signs, what's going on with you? Let's go talk about this. Let's dig a little bit deeper. Because it may not be something where the person's considering suicide immediately or that it's a crisis that's reached that level, even though these warning signs are apparent. But it could be. And so by opening up a conversation, getting more clues as to what's going on, and then if need be, asking directly, are you considering suicide? It's just invaluable information. And really learning to have that conversation with somebody about their mental health. I mean, the things that I've learned in QPR have helped me with my own daughter in learning how to ask her about the stresses that she's going under and just getting rid of that hesitation to talk about it. And I think that that's one of the really key things that is a takeaway. So it is for suicide prevention, but it's overall mental health because we have so many kids particularly that are going through this in silence because they don't know how to talk about it and their parents don't know how to talk about it. And sometimes, we chalk things up to just teenage moodiness when it really could be something more serious and need an intervention from a mental health professional. So QPR teaches how to have those conversations.
And it's an hour and a half at the most with role playing, and it's the best hour and a half that any parent, employer, teacher, all of us could invest in. And one of the things that is so interesting is you bust a lot of myths.
Exactly.
And there's a lot of taboo and a lot of shame and a lot of myths about this topic and about mental health. Tell us a little bit about the conference. Dr. Newcomer, you're a lead speaker, and we expect to have Dr. Joe Parks, the chair of the National Council on
Mental wellness.
Mental wellness. That's
Yes.
a newer name that I'm
Yep.
still stumbling over a little bit. Tell us a little bit both about the conference and what you expect to communicate and get out of it. It's going to be very exciting, folks. Register today because we are running out of space. You can register at namimiami.org. It starts with a breakfast at 8 a.m. on Saturday, March 4th. Program starts at 9.
Yeah, I mean, raising awareness. This is part of the big, full court press that
Yes.
Nami is leading. And this is a very important program, great lineup of speakers, and I think it'll be a great thing. I wanted to comment on something the Reverend said, though. It's not just asking questions about suicide. It's actually a famous sociologist, a woman named Lee Robbins, who right after World War II started doing the first sort of psychiatric epidemiology, sort of survey type of research. And she taught us all this tremendous lesson. You just have to ask people.
Right.
Everyone was so shocked that you could walk up and say, have you been sad? Have you felt sad in the last 2 weeks? And it's just as simple as that.
Yeah.
And in general, you start out with the broad questions and then narrow down. Do you sometimes feel like life's not worth living? And they say, yeah, actually I do. And then you can start to drill down into that and say, well, have you ever thought of taking your life? And it's amazing. People will answer those questions.
Right, right. And it's very important to have an open conversation like that without judgment and without fear. One of the other, since we're talking about that, one of the other lessons, though, that I know QPR teaches is that if you do not feel comfortable doing that, after being trained, some people just find somebody who does.
Yeah.
Whether it's a friend, a family member, an aunt, a grandparent, another colleague at work.
Yep.
So the conference is something we've been planning for a while, very exciting. We have a lead speaker, Kevin Hines, who has made it his life mission to help prevent suicides after he tried to take his own life by jumping off the Golden Gate Bridge. And he has been on MSNBC and CNN and ABC and Meet the Press and all kinds of wonderful. He's an amazing speaker coming in from California. So.
Yeah, we're very excited to have Kevin come in person. He's a dynamic speaker, and I think he'll really kick off the event in a very positive way with his story, because really what we want to do is convey hope. But we also are being very intentional in how we're crafting our panels to address some of the concerns that people have brought up. So like when we talk about diversity, what's happening in the Black community, in the Hispanic community, it's very important to talk about the rising suicide rates in those communities as well. With youth, where we have some youth that have gone through their own suicide attempts, and they're going to be speaking. And we also have parents that have lost a child to suicide that will be giving us the benefit of their wisdom and their experience. We're also going to be having resources. We're going to have a resource panel to talk about what's available locally in our community. And also in the main area of the conference center, we're going to be having resource tables so people can get more information. Wonderful. So really the main message we're trying to give is that there is hope. There's hope right here in our community for our kids, for our diverse populations, for anybody who is considering suicide. We really can turn the tide back and reduce the number of suicides. And by spreading the awareness that these programs exist and that the impact that it's having, we're doing all that we can to get that message out there.
Very important message, and I find when I speak with groups or one-on-one with individuals, people don't know what to do. Yeah. They don't know where to go. They're not aware of the amazing portfolio that Thriving Mind has amassed of best-in-class providers, a compassionate group of staff who answer questions, who take calls. They're not aware of sometimes of Nami. Yep. And the fact that we have questions, what income level do you have to be to take advantage of Nami services? It doesn't matter. We don't ask questions. It's open for everyone. So that resource information is very important.
We talked earlier in the show about some of the psychological factors, that may be contributing to all this, and those are all, important points. But I do want to emphasize that people who attempt suicide, there are known changes in their brains. It's a medical condition that increases the risk for impulsive acts like that. And suicide risk in the form of depression, right, the most common cause, this is a highly treatable condition, as treatable as blood pressure and blood sugar with your diabetes. The issue is recognition, getting somebody into treatment, and whether it's our network or any other, get in, get seen, get evaluated, and I would just back up the message of hope by saying there's hope because there are known proven treatments
Right.
of substantial benefit.
And you will meet through NAMI, through our conference, through our programs, people who are living successfully,
Yeah.
productively, and happily with bipolar disorder, serious depression, schizophrenia. It is treatable, and the family also needs the support to help guide their loved one or their friend into that. Final parting thoughts as we conclude our amazing program. Thank you so much.
No, thank you again. And treatable condition, but you can't treat it if you don't ask and recognize it and get started.
And I just want to emphasize that all our programs are free. So if you want to, we present free QPR to community organizations and online on Zoom.
To the workplace.
Exactly. And also the conference is free. So please take advantage of these great resources we have in our community to learn and be educated.
Thank you.
Great.
Connect with NAMI, NamiMiami.org. Register for our conference, register for QPR. We have other programs. I'm wearing a bracelet that says, I'm ending the silence. Are you? We have to end the silence on mental health. Thank you both so much. Thank you, Thriving Mind and Florida Department of Children and Families, for supporting NAMI's important work.
Thank you both.
See you on March 4th.